So cosmetic dentistry definitely can be achieved with veneers, right? That that Hollywood smile is usually veneers, lumineers, crowns. That's usually what it
Yes.
is all about, right?
Yes, yes. Cosmetic dentistry is that's what it's about. We can do some
Right.
smile makeovers immediately
I
for
I
people.
Let me ask you. I mean, while dentistry is obviously a very clinical and scientific and all that type of stuff, but it looks to me, especially talking about veneers, lumineers, and crowns, and this $1 million smile, this Hollywood type of smile, isn't there a tremendous amount of art in it? Almost like with dressing. I mean, with help my wife, I can't match up a shirt and a tie for nothing. Never mind a jacket to it. So while all my shirts and ties are pretty normal, nice shirts and ties, but I will mix them up. So aren't you dentists? They're very artistic, kind of like, look, a little longer doesn't look good, a little shorter doesn't look good, a little wider, a little rounder, or maybe only the conception that's super wide. That might not necessarily be the color which fits that person.
It is.
How are you guys coming in there with your artistic abilities?
It is an to do something cosmetically correct is absolutely an artistic. To give you an example, a patient comes in and he just has one tooth that requires something, and you're doing one veneer or one crown, and to match that color to the patient's smile becomes very, very important. And if you are able to achieve it, that's when you call yourself artistic. Secondly, you must have a very, very good technician who is very good at porcelain work in order to do the artistic work. Thirdly, before you decide on anything, you must do certain things. You go for a very good haircut. There are salons that will actually put a sort of styling on your hair. Take a photograph and put the styling on your hair and say, hey, is this what you like? So we can do that nowadays. We can have the patient smile. We can put the veneers on that smile and show the patient, okay, this is exactly what we are going to perform on you. Do you like that smile? Should we change this angle? Or should we make this a little shorter or this a little wider? We can do that exactly on the camera. That's one way of doing it. The other way is to do models, do wax up, show them exactly how it will look. So there, we can also make a temporary thing that they can wear right here on the premises, where we put this little appliance, and it changes their smile for them temporarily so they can wear it, and right there they can see the difference we can make. So the artistic ability has to be there in order to provide the right thing or the right result before you do it,
Right.
because
Right.
that's what the patient wants, and
Right.
and we achieve it that way.
Right.
So
And
yes,
I'm sure
artistic abilities.
I'm sure sometimes the patient doesn't necessarily hunt. I mean, he knows what he wants. He wants to look good. But sometimes, like when we go to a fashion designer or to an image consultant who tells us not to wear stripes or not to wear stripes this way or not to wear stripes that way, whatever it might be, you know what I'm saying? We sometimes need that input probably from the dentist to tell us, look, if we make your teeth a little shorter or if we make them a little long, and again, that's the people who say, hey, what do I need for a good smile? That they are relying probably a fair amount on you to show them the opportunities which can be done, because they might not necessarily, as I said, I might just put on two nice, very expensive shirts and ties and jacket, but it doesn't mean they match. Or it doesn't mean they might match, but they might not be my color or my personality. They might look funny on me because it's not me due to my complexion and the skin or whatever it might be. And you are helping patients with that, right? All right, or wrong.
Exactly, exactly. And then it's very important to see, how the patient smiles, where their lip ends up. Like when I smile, how much teeth do I show? you know. So where is my lower lip line? Where's my eyes? Where's the plane of my eyes? Are the teeth that I'm making for you parallel to that? And all of those kind of things. There are a lot of things that work towards making up somebody's smile, and we work through those things. And obviously, in my case, I'm always careful about making sure that I have got all the things that the patient likes into consideration, because I'm a listener, and I will always make sure that what my patient's goals are met in what I'm making for them. So that's how I go about solving their needs.
Well, Dr. Patel, thank you very much.
Thanks, Helmut.